Good afternoon. I am Dr. Deepak Kumar. I am a consultant nephrologist at BGS Global Hospital, Bangalore. So we come across with so many patients nowadays with various kidney diseases or kidney problems. The major objective of having a formal talk in this session is to create an awareness of this rapidly increasing kidney problem. I think previously, about 1 or 2 decades back, nobody knew of any major kidney diseases, or even if they knew, I think they used to not get medical attention, and they used to have a lot of morbidity and death because of kidney problem. But now last 1 or 2 decades, I think there have been various advancement in the kidney disease treatment itself, and there are various options of having a treatment for this kidney disease. But having said that, I think there is an alarming rise in this kidney diseases for the last 1 or 2 decades because of increase in the diabetic as well as hypertensive population. And since India is considered as a diabetic capital of the world, there has been a rapid increase in the diabetes related complications as well as hypertension related complications. Now this diabetes and hypertension leads to various target organ damage, that is various organ being damaged by the diabetes as well as hypertension. And among them, the most important is the heart, and of course the next important thing is a kidney. So being a nephrologist, we see a lot of patients coming with diabetes and hypertensive related kidney diseases. Now one will be wondering, are they only the 2 major problems, or are they only the 2 major issues which will affect the kidney? The answer is definitely no, because there are a lot of various conditions or various diseases which affect the kidneys and can produce kidney disease. Now just to have a brief knowledge about the kidneys. Now as we can see in this particular picture, we have every individual has got 2 kidneys in his body, one on the right side and one on the left side. So these 2 kidneys are situated on the posterior aspect in the body, that is retroperitoneally, somewhere in the region of back it is situated, and the major function of this kidneys is to excrete the water as well as the waste in the form of urine. So this excretion depends upon the function of the kidney. So normally functioning kidneys excrete all the waste as well as the water from the body, and once the kidneys get damaged, this excretion is impaired, and there will be a lot of accumulation of water as well as waste in the body, leading to various complications of kidney diseases. Now who all can get affected by this kidney problem? Actually there is no age bar for this kidney problem to occur. So it can occur from the birth till the person is of about 70, 80 or 90 years until he dies. So it has got such a wide variation of presentation with respect to age. So certain types of kidney diseases present early in the infancy or childhood, certain type of kidney diseases present in the middle age group, and certain type of kidney diseases present in the later age group. So based upon the etiology, that is based upon the cause for kidney diseases, it presents in different age group. Now when you take young people, that is infants or children or adolescents within 20 years of age, so usually the kidney disease which happen here are related to the genetic etiology or hereditary in origin, or related to the developmental defect in the kidney formation which happens in the perinatal period. Now when you take the kidney diseases which occur in the middle age group, they are always usually with acquired in the sense it is either because of diabetes or hypertension or certain inborn errors or certain hereditary diseases which can present late. So they can produce kidney disease at that particular age. Now, kidney disease which comes in the later age groups, that is after 40 or 50 or 60 years, most often it will be related to the diabetes as well as related to the hypertension. So there are various diseases which can produce this kidney problem. Now, the most common being diabetes mellitus. Usually, out of 100%, about 40% of the kidney disease is because of diabetes mellitus itself. So, which indicates that that is a major problem which produces diabetes, and that has to be tackled. Now, apart from that, the next important thing is hypertension, which can, produce this kidney problem. Apart from diabetes as well as hypertension, there are various other diseases like hereditary diseases like, polycystic kidney disease, wherein there will be cysts accumulating in the kidney over the years and ultimately leading to this kidney failure or kidney damage. That is one more etiology. Apart from that, there are various genetic or hereditary problems like what we call as glomerular disease, wherein there will be protein leak in the urine and leading to kidney disease on the long run. Now, apart from this, acquired is whatever happens because of taking some other medications like most commonly the painkillers, particularly the non-steroidal anti-inflammatory drug, that is the NSAIDs. They are the major culprits. Even one dose can produce sometimes kidney damage. So they are the other important etiological factors. Then certain antibiotics which are nephrotoxic, like aminoglycoside antibiotics, which are given in various infections by the local practitioners, they can also produce kidney disease. Apart from that, any dehydration caused by loose stools or persistent vomiting or any hypotension produced by blood loss also contribute to development of this kidney damage. Now, when we tell about kidney damage, there are two types of kidney damage. One is what we call as acute renal failure. The next one is the chronic renal failure. The acute renal failure is one which happens faster, that is within hours to days, and usually it recovers by appropriate therapy. Whereas the chronic renal failure is one which happens over months to years and which continuously progresses, and it cannot be reversed back with any form of treatment. So acute renal failure is the one which reverses, and chronic renal failure is one which will not reverse. So the distinction between these two is very important because we can tell the prognosis to the patient once we have a diagnosis. Now, once we know what are the different etiology producing this kidney problem and what are the types of this kidney problem, next we'll move on to what are the symptoms which can be produced in this kidney problem. Now, before going to the symptoms, I think it's very important to know that we saw in this particular diagram wherein we saw there are two kidneys. Usually, whatever the kidney damage happens, it will happen to both the kidneys because whatever diseases are there, it usually affects both the kidneys. However, there are certain group of causes or etiological agents which affects only one kidney, particularly like infection of the kidney, wherein there is what we call as pyelonephritis, wherein there is kidney being affected by the infection. There one kidney can be affected, one more kidney can be still intact without any infection and having a normal function. Otherwise, most of the diseases which are produced affect both the kidneys simultaneously. So I think that is an important thing to be known. Now, the next thing what I was discussing was regarding how these patients with kidney disease presents, or what are the symptomatology of this kidney problem. Now, in contrast to other major problem, what we have is an heart disease, which is a known fact. I think the awareness of heart disease has increased tremendously over the past 50 years, wherein the important symptomatology or wherein the important complaint with what the patient comes is having a chest pain or having excessive sweating or having breathing difficulty. Now, this kidney problem, in contrast to this heart problem, will usually present late and will usually present without any symptoms for a long time, and only on evaluation we will get to know that this particular patient has got a kidney problem. So that's why we call it as a silent killer, because the symptoms are very limited or very less appreciated by the patient. So there are various symptoms or various problems with which a patient can come to us with a kidney problem. Like suppose, for example, he can have swelling of both the legs. He can have puffiness in the face or periorbital edema, that is puffiness around the eyelids. Then they can have loss of appetite, that is decreased ability to eat well, and they can have repeated episodes of vomiting, particularly early morning vomiting when they brush their teeth is a most common symptom of the kidney problem. And apart from this, they can also have other symptoms like frothiness in the urine. When they pass urine, there will be increase in the frothing, which appears as a soap. So that is one more symptomatology. And they can have other symptoms like passing blood in the urine or passing red color or cola colored urine. So these are various symptoms which the patient can come to a nephrologist, or the patient can have, and still sometimes he neglects, thinking that it's just a normal day-to-day variation, because sometimes when he gets up in the morning he will have a bit of facial swelling. In fact, everybody will have a bit of facial swelling, so that he tends to neglect. The other important symptom is passing more urine in the night, that is increased frequency of micturition in the night, what we call as nocturia. So suppose the patient passes about 3 to 4 times, or even of course 2 to 3 times in the night, that is termed as unusual, because normally a person should not get up more than once in a night to pass urine. So if he has got this, then it suggests that he might, or he is likely to have some sort of a kidney problem. Now whatever symptoms I told now all hold good for a chronic renal failure or a chronic kidney problem. Now the patient can have acute renal failure or acute renal failure, wherein he can have sudden decrease in the urine output. That is, suddenly he was passing about 1.52 liters of urine per day. Suddenly it can come down to 500 ml or 750 ml of urine. So that tells that he probably has got some acute insult to the kidney. So any swelling in the legs again, or periorbital edema, decrease in the urine output should always point towards an acute etiology rather than the chronic renal failure. Now once we have these symptoms, we have certain laboratory tests to establish that the patient has got a kidney disease or a kidney problem. Now what are these laboratory tests? These laboratory tests varies from having a simple urinary test, they can extend up to blood tests, and they can go up to ultrasound or what we call as imaging. Okay. So now a simple urinary test, urine examination, what we call as urine routine, can give an information about so many things, like if there is protein leak in the urine, we can have a diagnosis with a simple urine routine. If they have got blood leak, what we call as hematuria, or passing cola colored urine examination will tell us about the diagnosis. And sometimes when the patient or the person has got urinary tract infection, again which affects the kidneys, can have a lot of WBCs or pus cells in the urine. So a simple urine examination is very important to establish diagnosis of a kidney disease. Apart from urine examination, we have some specific tests called as serum urea and serum creatinine, which will tell us about the functioning of the kidney. So they are the markers of the underlying functioning of the kidneys. So suppose urea levels being high or creatinine levels being high, then it tells that the kidney function is impaired. So these are the two tests which tells about the kidney function. Now apart from this, we have ultrasound abdomen, and which can evaluate the kidney size as well as structure, and which can tell that it is small or normal, or what is the functioning, or what is the stage of kidney disease what they have got. So with this evaluation, that is urine test, blood test and ultrasound, we can have a fair diagnosis of a kidney problem. Now once we have this diagnosis, whether it is acute or chronic, the treatment would depend on either it is an acute or chronic kidney disease. Suppose if it is an acute kidney disease, the prognosis, as I told, is better. That is, these patients generally do well and generally improve once we treat them properly. So treatment options for this acute kidney injury is to treat the etiology, what has produced this acute kidney injury. Suppose any drugs have produced, or suppose dehydration has produced, suppose infection has produced this acute kidney injury. Once we treat that, acute kidney injury or kidney problem will recover by itself. Only thing is, during that phase where there is this kidney injury, we need to support the kidneys by giving specific medications, monitoring the body fluids, and also if required doing a dialysis session. Okay, so this is a modality of treatment for acute kidney injury. Regarding dialysis, I would stress upon dialysis during the part of chronic kidney disease. Now the next important disease, that is a chronic kidney disease or chronic renal failure. Here the modality of treatment varies based upon the stage of the kidney disease. Suppose we have got 5 stages of chronic kidney disease, and stage 5 is the last stage wherein dialysis is absolutely required. However, in stage 1, 2, 3 as well as 4, we can treat the patients by advising them about fluid restriction or fluid modification, I would tell, and by telling them about specific diet, renal diet, and controlling the blood sugar, controlling the blood pressure well, and controlling the lipids if there is increase in the lipid level. So they form the mainstay in treatment of chronic kidney disease from stage 1 to stage 4. And apart from that, we have specific things to be done as the kidney disease progresses. Suppose we need to counsel them about having a dialysis in future. We need to create something called AV fistula, which is an access for dialysis, and we need to vaccinate them against hepatitis B virus. So from stage 1 to stage 4 kidney disease, chronic kidney disease, generally dialysis is not required or dialysis is avoided unless they have got various other complications. So in these 4 stages, we advise specific controlled sugars, as I told, blood pressure, treat them with anti-lipidemic agents, and most important thing is water consumption. Again, the water consumption depends upon the type of the kidney disease. Suppose if the patient's urine output is low, then we tell them to restrict the water to up to 1 liter. Suppose if the patient has got good urine output, then we tell them to take normal water, about 1.5 to 2 liters of water, whatever they are taking. And apart from the fluid, the most important thing is the diet. Usually in this stage 1 to stage 4 kidney disease, we tell them to avoid high protein diet. That is, protein is rich in meat, pulses, as well as other things like soya products. We tell them to avoid those high protein diet and ask them to take a protein diet of about 40 grams per day. That comes to about 0.8 gram per kg per day. Apart from restriction of protein, we tell them to restrict the intake of salt as well, because as we all know, higher salt intake will increase the blood pressure as well as increase the water accumulation in the body, and high amount of salt is not good for the kidney because it has to excrete more load. Then apart from this, we ask the patients from the stage 1 to 4 to reduce the potassium intake in the diet. Diet rich in potassium are mainly the salts as well as tender coconut, as well as the coconut itself has got high potassium levels. So we tell them to avoid these things. So, restricting protein, restricting salt, as well as restricting potassium form the mainstay of diet in the chronic kidney disease. Apart from that, we need to monitor them by calcium as well as phosphorus supplements. So next, that is the last stage, that is a stage 5 chronic kidney disease, is a disease which is deadliest among all the diseases in the mankind, because it requires some sort of renal replacement therapy. In the sense, we need to supplement the function of the kidney with an other form. The other form could be either a dialysis or it could be a renal transplant, that is taking out kidney from a close relative or a cadaver donor and then putting it into the patient with chronic kidney disease stage 5. So that is one option. The next option is dialysis. In dialysis, we have 2 types. One is a hemodialysis, which is done in the hospital, wherein weekly 3 times that hemodialysis is done, and each session of hemodialysis is for about 4 hours. And this dialysis requires some form of an access, what we call it as AV fistula, which I discussed in the initial part of my introduction. So this AV fistula is required, and through that dialysis is done weekly 3 times, and each session is about 4 hours. So this requires coming to hospital every alternate days, and that is every 3 times a week. So this is one form. The next form of dialysis is a peritoneal dialysis or a home dialysis, wherein the patient can be at home without coming to the hospital for dialysis. He can do dialysis at home, and this form of dialysis is less widely practiced as compared to hemodialysis, because the patient has to be educated, he needs to be taught about the home dialysis, he needs to be trained about home dialysis, and then he can perform peritoneal dialysis at home. Now this is the second modality of dialysis. So ultimately we have three modalities of therapy for chronic kidney disease stage 5 patients. We have hemodialysis, peritoneal dialysis, and renal transplantation. So apart from this, there are specific dietary advice when you are on dialysis or you are on transplant. Suppose you are on dialysis, you can eat well, your protein consumption can be better, your salt consumption can be more, you can take more water as compared to chronic kidney disease stage 1 to stage 4, where we restrict everything. So here we can be a bit more liberal, because all the waste, all the water, all the toxins are removed by the modality of dialysis. And of course renal transplantation is a completely different form of therapy, wherein again after transplant we advise specific medications and specific diet for these particular patients. So to conclude, or to just have a final remark, I would say that kidney disease is a most deadliest disease in the mankind, and the incidence as well as the prevalence of kidney disease has increased tremendously over the past 1 to 2 decades because of increase in the diabetes as well as hypertension, and of course the ability to detect this kidney problem at an earlier stage. I think what is important is to have a fair knowledge of this kidney disease, its various symptoms and the laboratory tests, and then a close follow-up with a nephrologist or a treating physician, and then to have a fair knowledge about what are the treatment options available for this kidney disease. Now I think I'll just conclude here after giving a brief, whatever I have said is very brief about kidney disease. Still there is a lot to be known, and there are a lot more insights into this kidney problem. So I would tell everybody that take care of your kidneys, and whoever has got a kidney disease, have a close follow-up with your physician, and at least if a person is diabetic, or if a person is hypertensive, and if he has got any symptoms which I discussed of the kidney disease, it's always better that he consults his nephrologist at the earliest, so that early diagnosis can make a lot of difference, and the progression of chronic kidney disease can always be delayed. So all the best, and thank you for hearing my brief conversation about kidney disease. Thank you.